Did you ever expect it to be that high?
No, Martha, I did not. But, that's what happens when you're in a situation where you have surges related to so many factors, inconsistent adhering to the public health measures, the winter months coming in right now with the cold, allowing people or essentially forcing people to do most of their things indoors as opposed to outdoors, and then the traveling associated with the holiday season is all of the ingredients that unfortunately make for a situation that is really terrible. I mean, to have 300,000 cases in a given day and between 2,000 and 3,000 deaths per day is just terrible. I mean, it is. I mean, there's no running away from the numbers, Martha. It's something that we absolutely got to grasp and get our arms around and turn that inflection down by very intensive adherence to the public health measures uniformly throughout the country with no exceptions.
Dr. Fauci, the president just tweeted that the number of deaths is far exaggerated, blaming the CDC's what he called ridiculous method of determination compared to other countries. Your response to that?
Well, the deaths are real deaths. I mean, all you need to do is to go out into the trenches, go to the hospitals, see what the healthcare workers are dealing with. They are under very stressed situations. In many areas of the country, the hospital beds are stretched. People are running out of beds, running out of trained personnel who are exhausted right now. That's real. That's not fake. That's real.
And Dr. Fauci, we saw that the U.S. is vaccinating only about 200,000 people a day, with many states using just a small percentage of the vaccines they have received. What's the biggest cause of this delay?
Well, I think it's just trying to get a massive vaccine program started and getting off on the right foot. There have been a couple of glitches. That's understandable. I think the next week to week and a half, because the original projection that General Perna, who's in charge of the actual ultimate shipping and distribution, there's allocation, there's shipping, there's distribution, and then there's putting it into people's arms. So they were promising that they would have about 20 million doses that were allocated, shipped, and distributed. They fell short of that by the end of December, but in the first couple of days in January, they're catching up with that. What we need to catch up with now is getting into people's arms, because there's now about 4 million. We wanted to get to 20 million. But some little glimmer of hope is that in the last 72 hours, they've gotten 1.5 million doses into people's arms, which is an average of about 500,000 a day, which is much better than the beginning when it was much, much less than that. So we are not where we want to be. There's no doubt about that. But I think we can get there if we really accelerate, get some momentum going, and see what happens as we get into the first couple of weeks of January.
And Dr. Fauci, the president puts responsibility on the states, but Utah Senator Mitt Romney, as you might have just heard, wrote this week that it was unrealistic to think that healthcare workers already overburdened, or CVS and Walgreens, could really handle that vaccination program, writing that comprehensive vaccination plans have not been developed at the federal level and sent to the states as models is as incomprehensible as it is inexcusable. Is that inexcusable?
Well, what we need to do, Martha, is we've got to get interaction between the federal government and the states. To say the federal government should do it themselves, that'll never happen. To just leave the states on their own without any help, without any instruction, without any resources is going to be tough. You've got to have a combination of both. You have to have a real interaction, a real partnership between the federal government and the states. That's what we're trying to do. Hopefully that will then materialize as we get into the beginning of this year. But you're absolutely right.